Hello, my name is Edith. I'm going to be your nurse today. Can you tell me your first and last name and date of birth, please?
Deborah Peterson, 9/9/1959.
Okay. Thank you, Deborah. And I am here to do an assessment on you today. Is that okay?
Yeah.
Okay. So for the purposes of this video, to maintain the privacy of my willing volunteer, I will be auscultating above the shirt, but in a clinical setting with a real patient, I would do everything below the gown on the skin. As well as with inspection, I'll just be doing inspection of what I can see, and I'll verbalize what I would be looking for, just to maintain privacy of my volunteer. Okay, so the first thing we're going to start with is the chest. So I'm going to go ahead and take a peek at the skin, and the skin is appropriate for her ethnicity, and I'm touching it. It's warm and it's intact. There's no lesions or cyanosis noted. Okay, the next thing I'm going to look at is the anterior posterior lateral ratio. So this would be looking for that barrel chest, but here the ratio I see is 1:2, and that's normal. Okay, so the next thing I'm going to do is check for normal fremitus. So I'm going to palpate posteriorly on the lungs and feel for any changes in vibration as Deborah says the word 99. Okay, so Deborah, I'm just going to go ahead and feel and just say the word 99.
99.
Okay, and again.
99.
Again.
99.
And again.
99.
And again.
99.
Again.
99.
Again.
99.
And again.
99.
Okay, there's no changes in vibration, which is normal. So next I'm going to go ahead and auscultate the lungs. And so for the purposes of this video, I will just be doing it posteriorly, but I would also do it anterior and laterally as well. So Deborah, I just want you to take some big deep breaths for me when I tell you to. Okay, so go ahead and big deep breath. And again. And again. And again. And again. 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 And again. And again. And again. And one last time. Okay. And so the lung sounds were clear bilaterally, so no adventitious lung sounds. Okay, and the next thing I'm going to check for is egophony. So what I'm going to do is I'm going to auscultate posteriorly while Deborah says the sound E, and what I should hear is the sound E and not the sound ah. Okay, so Deborah, just say the sound E when I tell you to do so. Nice, go ahead and say E.
E.
And again.
E.
And again.
E.
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 Okay, good job. So I heard the sound E, which is normal. So Deborah, next part, I'll have you go ahead and lay on the bed for me. Move this out of the way. Okay, so now we're going to move on to the cardiac system. So I'm going to go ahead and auscultate heart sounds, and I'll explain where I'm auscultating as I'm doing it. So we're going to listen in 5 different places. And so the first is going to be the aortic, and this is going to be on the right sternal border at the second intercostal. Okay. And so here S1 and S2 are present, and S2 is going to be louder here as well as in my next place, which is the pulmonic. So you just move over, it's at the left sternal border, second intercostal. S1 and S2 present, and S2 is louder. Erb's point, you move down, it's on the left sternal border, third intercostal. S1 and S2 are noted. Then I'm going to listen for the tricuspid. And here's where S1 is going to be louder, and this is at the left sternal border, the fourth intercostal. Then we're going to listen at mitral, which this is where we're going to take the apical pulse, and this is going to be at the fifth intercostal midclavicular. So we're going to go ahead and take the pulse for a whole minute. And for the sake of that video, we're going to say it was a whole minute, okay? Next thing I'm going to do is palpate the pulses. I am just going to do it on one side for the sake of this video, but I would normally do it on both sides. Okay? So we'll go ahead and start with the temporal. So that's 2+. The carotid, pretty strong, that's 3+. The brachial, say that's 2+. The radial, pretty strong, say that's 3+. And then we're going to come to the posterior tibialis, 2+, and the dorsalis pedis, which is 2+. Okay, now we're going to move on to the abdomen. So the first thing I would do is inspection, and so I would just take a look, and I see that the abdomen is symmetrical, it's rounded, and then I would also take a look at the skin to make sure there's no abnormalities there, make sure the skin's intact, as well as the umbilicus, make sure there's no discoloration and that it's midline. And so the first thing I'll do is auscultation of the abdomen. So I'm going to start in the right lower quadrant and go in a clockwise motion. And bowel sounds are present in all 4 quadrants. Next thing I'm going to do is palpation. I'm going to do light palpation first and then go deeper and do a deep palpation second. So I just wanted you to tell me if you have any pain or tenderness when I do this. I'm going to do it in all 4 quadrants, and I'm also checking for any abnormalities or masses. So light palpation first. Any pain or tenderness? Okay. Now the deep palpation. Pain or tenderness? Pain or tenderness? No pain or tenderness? Okay, so no pain or tenderness upon palpation and no masses or abnormalities noted. Next I'm going to do percussion, and I'm going to listen for that tympany, which is normal. Okay. Okay, and the tympany was heard. Oops. Okay, and then the last thing we're going to do is, Deborah, I'm going to have you sit up for me, is we're going to check for CBA tenderness. I would do this on both sides normally, but for the purpose of this video, just one. So I'm going to find the 12th intercostal, so that last rib, and then the spine, and put my hand in this little triangular space. And then I'm going to take this fist and just kind of tap on the back of my hand. And Deborah, I want you to tell me if you have any pain or tenderness, okay?
No.
Okay. And that concludes the video.